The Senate will please come to order. It's my pleasure to welcome for this afternoon's devotional exercise, Reverend Mark Wilson of Waitsfield United Church of Christ. Welcome, Reverend. The floor is yours.
Welcome, folks. Welcome to the Waitsfield Church of Christ, gathered in 1796. This is the first church gathered in Washington County. As introduced, I'm Mark Wilson, the pastor here. First thing I want to say to you this afternoon is, on behalf of the people of the state of Vermont, thank you. Thank you for your service to this great state. As the wind was whipping around the house here again this week, I was thinking about how the word in Hebrew for wind and breath and spirit and life is the same word. The word is ruach. It's a feminine noun. Before brain waves could be measured, if someone was breathing, they were living, and so it is no surprise that breath became synonymous with the creative life force of the divine. In New Testament Greek, the word became pneuma, a gender-neutral word from which we get pneumonia or pneumatic. In Latin, the idea became spiritus sanctus, which is a male noun. The idea of life and breath and the divine crosses many other traditions. In Native American tradition, folks speak of the four directions or the four winds. In Hindu and Buddhist meditation practices and in yoga, focusing on one's breath is key. And in my own Christian tradition, Jesus says that the wind blows where it chooses, and so are those who are born of the Spirit. And so as we open this session, let us remember to breathe. Let's focus us on the present and cleanses our minds. In lieu of a prayer then, I would only ask that together we take 3 deep breaths. Amen.
Amen. Thank you. It's wonderful. Are there any announcements this afternoon? We have a referral pursuant to Rule 31, Senate Bill 206, an act relating to planning for the care and treatment of patients with cognitive impairments being on the calendar for notice and impacting the appropriation or expenditure of funds under Rule 31 is referred to the Committee on Appropriations. We don't have any House bills. We have 1 House bill, 4 House bills for introduction today, H 491, an act relating to the creation of Essex Junction, of the City of Essex Junction, and the adoption of the city charter, which was introduced on January 7th, and read for the first time, referred to the Committee on Government Operations, shall be read for the first time.
H 491, an act relating to the creation of the City of Essex Junction and the adoption of the city charter.
You've heard the first reading of H 491, and the bill is referred to the Committee on Government Operations. H 515, an act relating to banking, insurance, and securities, introduced in the House on January 7th by Representative Marcotte of Coventry. Please listen to the first reading of H 515.
H 515, an act relating to banking, insurance, and securities.
You've heard the first reading of H 515, and the bill is referred to the Committee on Finance. H 708, an act, relating to the approval of an amendment to the Charter of the City of Burlington, introduced in the House on February 16th. by the Committee on Government Operations in the House. Please listen to the first reading of H 708.
H 708, an act relating to the approval of an amendment to the charter of the City of Burlington.
You've heard the first reading, and the bill is referred to the Committee on Government Operations. And finally, H 709, an act relating to miscellaneous agricultural subjects, introduced in the House on February 16th by the Committee on Agriculture and Forestry. Please listen to the first reading of H 709.
H 709, an act relating to miscellaneous agricultural subjects.
You've heard the first reading, and the bill is referred to the Committee on Agriculture. This brings us to the orders of the day. We have on the calendar for third reading, H 367. Third reading was ordered on February 2nd. H 367 is an act relating to the management of perpetual care funds by cemetery associations. Are there any amendments before third reading? Please listen to the third reading of H 367.
H 367, an act relating to the management of perpetual care funds by cemetery associations.
The question now is, shall the bill pass in concurrence? Are you ready for the question? Kindly unmute. All those in favor, please say aye.
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 Those opposed, nay. The ayes have it, and you've passed H 367 in concurrence. We have on the calendar for action H 654, an act relating to extending COVID-19 healthcare regulatory flexibility, which was read for the first time on January 28th. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the bill be amended as set forth on page 533 of today's calendar, and that when so amended, the bill ought to pass. Please listen to the second reading of H 654.
H 654, an act relating to extending COVID-19 healthcare regulatory flexibility.
The senator from Chittenden, the chair of the Committee on Health and Welfare, is recognized for the report of the committee.
Thank you, Madam President. This is, again, a very important bill to us as we have gone through the various portions of the pandemic and the more recent surge. And as that's happened, we've passed a number of bills, including Act 6 in 2021, Act 140 in 2020, and the first Act 91 in 2020. We all know the pressures that have been placed on our healthcare providers, our healthcare institutions, and this bill continues some of the regulatory flexibilities that are needed in order to ensure that healthcare is available for Vermonters. I'll go through the bill very briefly, Madam President, simply because we have been through many of these sections at least 3 other times. And so it becomes a reminder for where we are in allowing for some flexibility in the provision of health care. We did meet very early on in the session with our House counterparts, another committee, to listen to testimony. So part of the work that was done in the other body is consistent with our thinking and work that we contributed to. And then finally, as the bill came to us from the other body, we went through again and validated some of the work that had been done. So, Madam President, I'll begin with sections 1 through 4 of the bill. And just to note, as you're going through the bill that the Secretary sent out earlier today, the sections may look uneven and skip, and that's simply because we are modifying three other laws that are temporary laws for our work. It does get confusing and complex, as we say in our committee. It's more complicated than that. And this bill is certainly complicated in terms of understanding the sections. I'll try to be as clear as I can as we go through. So in section 1, the Agency of Human Services will have consideration, we've given consideration to modify existing rules or adopt emergency rules to protect access to healthcare services. In section 3, provides protections for employees of healthcare facilities and human service providers. The bill expands the scope of guidance to include state and federal public health guidance. And that section, that line to include state and federal health guidance is new in this bill from the others. Section 4 provides authority for the Agency of Human Services Secretary to waive or allow variances from rules and standards governing providers of healthcare and human services. And there's a list of those services and organizations that are provided in the bill. I won't go through them. Section 5 gives authority for the Green Mountain Care Board to waive or allow variances for law, guidance, or standards on certain regulatory procedures. And one of the things that's added here in this bill that's new is that during budget process, consideration for labor costs will be included. And that's very much related to the significant issues that we see with healthcare workforce in our state. Section 8 provides authority for the Department of Financial Regulation to adopt emergency rules regarding health insurance coverage and cost-sharing requirements for diagnosis, treatment, and prevention of COVID-19, and regarding prescription drug deductible requirements. This section has been extremely helpful during the past couple of years during the pandemic. That is section 8, and I'm sorry, I probably skipped ahead of section 6. Section 6 offers flexibility in provider credentialing requirements from Medicaid and health insurers. Section 9 allows for early refills of maintenance medications for folks who would like to have their medications on hand. Section 13 provides and allows for buprenorphine prescription renewals without an office visit. That's section 12. I apologize. I said section 13. Section 13 provides authority for the Agency of Human Services to pay long-term care facilities for bed hold days. This is a continuing concern for our long-term care facilities where they have open beds and they have no reimbursement for them. So this helps. Section 17 allows for out-of-state licensed healthcare professionals and recently retired inactive Vermont licensees to provide services in Vermont as volunteer members of the Medical Reserve Corps and to be on staff of a healthcare facility. The bill limits the service of out-of-state licensed professionals on staff of healthcare facilities for 6 months. So there's a bit of re-upping there for those folks. And we also have adopted telehealth provisions that for these folks as well, which is a temporary adoption. Section 20 provides emergency authority for the Director of the Office of Professional Regulation and the Executive Director of the Board of Medical Practice to act for their boards. Section 21 provides authority for the Office of Professional Regulation and the Commissioner of Health to issue emergency regulatory orders to protect public health, safety, and welfare. Section 26 provides a waiver for Hipaa compliant connections requirements for telemedicine, and this will extend to the extent permitted under federal law. The bill would also require that providers gain a patient's informed consent. In previous bills, we did not ask for providers to ask for patients' informed consent when using telemedicine, and now they will be asking for that. Section 2, now we're moving to Act 140. It's a different set of sections. Provides authority for the Board of Medical Practice to issue temporary licenses to out-of-state providers and to waive certain requirements for physician assistants and podiatrists. Section 15, which is actually Section 12A in the bill you're looking at, I believe, places a sunset on the pharmacist's authority to order and administer COVID tests. Section 4, which is going back to Act 6 of 2021, provides DFR, Department of Financial Regulation, with authority to adopt emergency rules on health insurance coverage and reimbursement for telephone triage calls. Sections 5 and 6, moving through the bill, provide out-of-state healthcare professionals with ability to use telehealth. Section 5 continues the existing authority until March 31st, 2022, and then Section 6 picks up and allows that authority to go forward until March 31st, 2023. The other sections that we've been talking about will continue until March 31st, 2023. Section 7 provides that extends through March 31st, 2023, provisions that allow for variation from the usual statutory witnessing for our advanced directives program, where witnesses and explainers can be remote for those folks putting together their advanced directives. The effective date for the bill is on passage. Now, just a comment on the dates that are here, and the reason that we're looking at a bill that has an H in front of it at this time, the bill, many of the provisions that are in the previous bill, Act 6 and the others, end on March 31st, 2022. And the provisions that we are putting in this bill will extend until March 31st, 2023. So there was a sense of urgency to pass this bill as quickly as possible to the governor and to the governor's desk for his signature, so that our healthcare system, our healthcare providers, our hospitals, and others would be able to continue providing the important services that we so need during this ongoing crisis. So thank you, Madam President. We did hear from a number of witnesses. I'll go through the list briefly. Jennifer Carby, our legislative counsel, the Vermont Health Advocate, the president of the Vermont Retail Druggists, the reporter of the bill from the House, Lori Houghton, Representative Lori Houghton, the director of the Department of Vermont Health Access, the director for the Office of Public Regulation, the executive director for the Vermont Nurses VNAs of Vermont, the executive director of the Vermont Medical Society, the vice president of government operations for the Vermont Hospital and Health Systems Association, the executive director for the Board of Medical Practice, the chair of the Green Mountain Care Board, and then members of our private insurers, Blue Cross and Blue Shield and MVP. So, Madam President, that is the report. The vote was 4-0-1, but reassurance that the individual who had to be absent, the senator who had to be absent from committee on the day we voted, has reassured me that he would have voted yes on this bill. So, but thank you, Madam President.
Thank you, Senator. And just a point of clarification, when introducing you and recognizing the history, I did mention a proposal of amendment, which there is not. It's a favorable report. So there is only one question, and the question is, shall the bill be read for the third time? Are you ready for the question? Kindly unmute. All those in favor, please say aye.
Aye.
All those opposed, nay. The ayes have it, and you've ordered third reading of H 654. We have on the calendar a report from the Committee of Conference, which was appointed to resolve differences between the two bodies on H 679, an act related to fiscal year 2022 budget adjustments. The senator from Caledonia, the chair of the Committee on Appropriations, is recognized for the report, and the addendum can be found on the Senate calendar for February 23rd.
Thank you, Madam President. I'd like to present the conference committee report on the budget adjustment for fiscal year 2022. It is a strike all, so the addendum seems very long, but I would like to indicate that, in fact, the changes between the bill that we passed this bill that we passed earlier and the conference report is quite limited in the number of changes. And I will walk through those areas where agreement was different than the bill as it was passed by this body. And first, I would like to say that there are 3 documents, one of which is the highlights, and we are specifically shading the sections that relate to the changes that were made as part of the conference process. We also have a tracking list, and we also have a web report, which you'll see a lot of, most sections reflect no change. In section 46, we reduced the amount of the vaccine incentives from 150 down to 50,000 and directed the money to the 4 academies that function as public high schools: Burr and Burton, Linden, St. Johnsbury, and Thetford. The original proposal was to make this much more expansive, and this is general fund, and it was to celebrate vaccines. And so the other body had no funding, and this was the compromise that we would provide a vaccine incentive to these 4 educational institutions. The next change was we had $1 million to function as grant matches. We found out that, in fact, one of the applications that would be filed by ACCD, the timing was not quite the same, and there was some belief that, in fact, there was sufficient carry forward to serve as the match for that $500,000. If that turns out not to be the case, then we will be able to address it as we're finishing the FY23 budget. So that $1 million was reduced to $500,000, and that would be the grant for the build to scale, match for the build to scale grant that would work with 3 communities: Rutland, Randolph, and Springfield, as it relates to the economic activities. Section 48, we had some changes here because we took several appropriations and moved them into the end of the year financing construct. And so we had direct appropriations for the correctional industries, cannabis board, which right now there's no revenues to support the cost, and we really didn't want to start the program with already with a deficit. And so we moved those 3 appropriations down into the end of the year construct. That resulted in moving the carry forward or the reserve of 81 million up to 86 million. So in the end of the year, in section 53, you're going to see that we have the 850,000 for the cannabis board cost, the 1.7 for state liability self-insurance, the 1.877 for correctional industries internal services deficit, and something that was new, and this relates to an expenditure that we have regarding the pension and retiree healthcare benefits. And so in the FY23 budget, there was one-time funding for Medicaid, but we are believing that with the FMAP, the higher federal match, that there will be money available. So what we're doing is putting the 9.9, nearly 10 million of Medicaid into that contingent appropriation. Once again, these are contingent appropriations. And the reason that we're doing that is for the first time, we are going to be really setting up a process to start pre-funding healthcare benefits for state employees when they retire. We have not done this. We have been funding these benefits on a pay-go basis, and the underfunding of healthcare benefits for state employees is actually higher than the pension underfunding. So this is really important. We were recognizing the need to address that contribution to set up the healthcare trust fund for that post-employment benefit, which the benefit has been there, but there has been no specific funding source other than just pay-go on the general fund. And then the other body really wanted to take more time to look at the overall debt of the state. And so we reserved $25 million to improve the debt position of the state. That could include the redeeming of government general obligation bonds, or reducing new debt, or addressing negative internal fund balances. And so it was an opportunity to really look at where those debts reside and how we want to address which ones would be most compelling, and that we reserved $25 million there. And then the remaining ARPA funded were some language around the payment to childcare providers. We rewrote that a little bit to make it clear where the payments would go and to whom. We also had to deal with Section 72, which had to do with the workforce recruitment and retention. And there's no question that our healthcare providers, and particularly those community-based providers that are providing essential services to people with mental illness, intellectual developmental disabilities, substance abuse, and our choices for care providers are under a great deal of stress and struggling with workforce. And it has compromised their ability to provide the services to Vermonters who are served in those general care categories. So we had to work with the Agency of Human Services to come up with a payment structure that was easy to administer, that would get the money out. And what we have ended up doing is really creating 2 rounds of funding. The first would be to those providers where the demonstrated need is most acute. And then that would be $45 million, and then $15 million would go to a larger universe of providers that would where there has been demonstrated need that was that could be addressed. If more than $45 million is needed out of the total of 60, which is remaining unchanged, then there's authorization to access the additional funds. And then Section 80 we removed. We know that there's discussion about on the federal level with the individual and small group market merger, but we had communications that because of timing, it was really difficult to write that section. We recognize that there may be need to be additional action, but would do that either through a health-related bill or in the big bill itself. So the amount of money changes is really very, very minimal. It's really reducing the grant funding from $1 million to $500,000 and reducing the vaccine incentives from 150 down to 50. And then we did, as I say, change the year-end construct. At this point, we know revenues are coming in stronger than the estimates that were revised just last month. And we believe that we will be able to accommodate those areas of spending, of those itemized areas that are there in the contingent list. And then if the amount of revenues in fact exceeds that, it would be carried forward in unreserved and available to address FY23 needs. The committee of conference was unanimous in support of the report, and we hope this body will concur.
Thank you, Senator. The question is, shall the Senate accept and adopt the report proposed by the Committee of Conference on H 679? Are you ready for the question? Kindly unmute. All those in favor, excuse me, the senator from Chittenden is recognized. Sorry, Senator.
No, that's okay. I was a little slow on the draw, Madam President. I wonder if I could inquire of the reporter.
You may.
Madam President, I want to stay within bounds here, but as I understand, the conferees were sent a letter from the 5th floor, and I guess I've been really confused by the give and take, and I know that when the Senate passed this, there was an amendment offered by the senator from Franklin County and perhaps others that sort of in the vein that the administration had talked about it. So would it be appropriate to ask you to just describe some of those dynamics and what you see as the answers to the critique from the administration?
Well, I guess I would get into a definition of what we view as the appropriate use of the federal ARPA funding. In the budget last year, we had 5 categories of spending and where we would allocate money, general fund, ARPA, or other funding. And it seems as though we have a difference of, we're reading a section differently. And I know that there was a press conference and the one category was described as economic recovery. However, if you look at what is in the budget adjustment, you will see that there's money for workforce. And that workforce is both in the area of the providers that are essential to services, and that gets back to the DAs, the SSAs, and the choices for care providers, for example. The category as it's described in the budget bill that we passed last year that was signed into law, that category is not just limited to economic recovery. It's the health, well-being, and recovery of Vermonters, workforce development, and business supports. And so we have appropriations here that we feel are consistent with that. And I'm talking about the workforce development, which gets into the, which remained unchanged in the bill as it came to us. And that was funding to the state college system for critical occupations, $1 million to UVM for upskilling. And we view that as very consistent with that category that includes workforce development. The other area that there is seems to be of dispute is how we're handling housing. And the budget adjustment, in fact, increases the funding to VHCB by $5 million. Originally, the proposal as it came from the administration was to use all ARPA funding. That was changed to do a combination of 25 million ARPA, 30 million general fund. And the reason for that is ARPA funding cannot be used to leverage federal tax credits. General fund can, and by putting more general fund in that area and not using as much ARPA as was proposed, allows more funding to come in and therefore would expand the housing initiatives that could be supported. The other area that is, and I need to make it clear, was not in either version of the budget adjustment, and that's the $5 million for the missing middle home ownership. Both the policy committees in the House and the Senate took testimony. No one is disputing that there's a need, and that was and the $5 million. The question was feeling or wanting to have an opportunity to have what that program would look like fleshed out a bit more. And so my plan and my intent would be although it was not included because of just the need to take more time to define the program and understand how it would work, and allow modifications if the policy committees felt it was necessary, that $5 million would travel in the big bill. The other area, when I presented the budget adjustment, was the $20 million to fund rehab of empty apartments and bring them up to code so they can come onto the rental market. We put that $20 million we didn't include it in the BAA, as you may remember, as I presented the bill originally. The 20 million went into S210. Last year, we had a dilemma with the money being in the budget and the program created in a different bill that was vetoed, and there was some questioning as to whether the money should have gone out without the program. So the 20 million is still there, and it's in a bill that we've already passed, and it's in the House, and the House has indicated that they intend to act on that swiftly. So I guess I would say it's not a matter of some of the money in that regard on housing. It's what vehicle the funding would travel in. And then the other is the use of ARPA funding, particularly in the area of workforce development, human capital investment in Vermonters, and addressing those most severe areas of workforce shortage.
Thank you, Madam President. I thank the presenter for her usual good work and thorough answers. And I'm heartened by the combination of, and we see this more and more with, at least I do, with constituents who are frustrated with one bill that doesn't contain another element that is in fact traveling elsewhere. So I hear strategy, I hear solutions that maximize federal dollars, and I appreciate the good work of the committee and look forward to voting yes. Thank you, Madam President.
Madam President.
Please go ahead.
Yes, the other thing that I would really like to just point out, and that is we increased the carry forward from 81 to 86. And we know that with the additional federal money, and that's why we rewrote Section G, is that those general fund dollars are going to be really important in our ability to provide the state match for those projects that can be funded through that federal infrastructure grant. And many of them would be areas that we know there's tremendous need, water quality, and other areas that would fall into, for example, wastewater systems and so forth. So we know as we look to the future, if we are to maximize those federal funds and finding the match that is required, it's going to really require some thinking about how to have those match dollars available. And that really is part of our thinking. It's not just a matter of the BAA, it's thinking about leveraging and meeting the match requirements so that we can maximize and draw down those federal dollars in infrastructure areas that are without question badly needed. So thank you, Madam President.
The senator from Chittenden is recognized again. Senator, do you wish to be recognized? No. Okay. The senator from Addison is recognized. Just making sure we're not missing anybody here. Sorry.
Thank you, Madam President. May I inquire of the reporter?
You may.
Thank you. I'm wondering if you could just go back to the section on, I think it's section 72, I believe, in the bill on the workforce retention, the $2,000 grants. There's the 45 million that's set aside for certain employers and then the additional 15 million. Is it correct to say that the 15 million would, if there's more need among those identified employers than the 45 million can support, would the 15 million go first to those employers and then to anyone else? Or is that 15 million set aside for a different set of employers?
Thank you, Madam President. I'm sorry I wasn't clear. Because we are not sure how that split should work, and we were dealing with that dilemma of how big we make the universe versus how targeted. And so what we did in the end was say, let's allocate. That was our best estimate of 45 out of the 60 would go to that identifiable universe, very similar to what we were doing in certain subgroups of state employees. And it would be that payment per FTE. If in fact 45 turned out not to be sufficient and it's 49, the language there allows the access to that 15 million to support the benefit to those specifically tier round one employers. And then there would be, in this case, if we took 3 million off the 15, it would be 12 that would be available for the other provider groups.
Okay, wonderful. You were clear. There's just a lot to absorb at the same time. So I appreciate your re-explanation. Thank you to the presenter, and thank you, Madam President.
The question is, shall the Senate accept and adopt the report proposed by the Committee of Conference on H679? Are you ready for the question? Are you ready for the question?
Call, Madam President.
I believe that was Senator Sears. Yes. The senator from Bennington has requested a roll call vote on H679. The senator from Windham is recognized.
Thank you, Madam President. Just briefly, I've been thinking so much lately about how many of our constituents don't fully understand the work that we do here. And I just want to highlight that we still very much have a functioning system here in Vermont. A successful committee of conference is really a testament to the work of the chair of appropriations in the Senate and the chair in the other body and the other members of the committee that were able to work together to bring forward a package that would meet the needs of not just the legislature, but hopefully the executive branch as well. And I just wanted to highlight that this doesn't always happen well at the federal level, but it still works here in Vermont. Thank you, Madam President.
Thank you, Senator. Are you ready for the question? Again, the senator from Bennington has requested a roll call vote. Secretary is kindly asked to call the roll.
Senator Ballant.
Yes.
Senator Baruch. Senator Benning.
Yes.
Senator Bray.
Yes.
Senator Brock.
Yes.
Senator Campion.
Yes.
Senator Chittenden.
Yes.
Senator Clarkson.
Yes.
Senator Collmore.
Yes.
Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Hooker.
Yes.
Senator Ingalls.
Yes.
Senator Kitchell.
Yes.
Senator Lyons.
Yes.
Senator McDonald.
Yes.
Senator Mazza. Senator McCormick.
Yes.
Senator Nitka.
Yes.
Senator Parent.
Yes.
Senator Pearson.
Yes.
Senator Perschlick.
Yes.
Senator Polina.
Yes.
Senator Rom Hinsdale.
Yes.
Senator Sears.
Yes.
Senator Sirotkin.
Yes.
Senator Starr.
Yes.
Senator Terenzini.
Yes.
Senator Westman,
Yes.
Senator White,
Yes.
Senator Baruth, Senator Mazza,
Please listen to the results of your vote. The yeas 28, the nays 0, and you've accepted and adopted the Committee of Conference on H 679. We will now take up SR 18, Senate Resolution relating to adoption of a temporary rule of 44A, which was placed in the calendar for action. The resolution has been read already and is set forth in today's journal, or yesterday's journal, excuse me, which you should have. The question is, shall the Senate adopt the resolution? Are you ready for the question? All those in favor, please say aye.
Aye.
Those opposed, nay. The ayes have it, and you've adopted SR 18. This completes the orders of the day. The senator from Windham is recognized.
Thank you, Madam President. Pending announcements, I move that the Senate stand in. Oh, before the, my apologies. At this time, I ask that the rules be suspended and we message our action on H 679 to the governor forth. Back to the House. Thank you.
Thank you, Senator. The senator from Windham has moved the rules be suspended and H 679 be messaged to the House forthwith. Are you ready for the question? All those in favor, please unmute and say aye.
Aye.
Those opposed, nay. The ayes have it, and you suspended the rules and messaged H 679 to the House forthwith. I believe now, there we are. The senator from Windham is recognized.
President, pending announcement. At this time, I move that the Senate stand in adjournment until Friday, February 25th at 11:30.
The senator from Windham has moved that subject to any announcements, the Senate do adjourn until Friday, February 25th at 11:30. Are there any announcements? The senator from Washington is recognized.
Thank you, Madam President. Senate Finance will meet at 2:00.
The senator from Windham is recognized.
Thank you, Madam President. Senate Government Operations will meet at 2:00.
The junior senator from Bennington is recognized.
Thanks, Madam President. Senate Education will meet at 2:00.
And the junior senator from Caledonia is recognized.
Madam President, institutions will meet at 2:00.
Are there any additional announcements? Seeing none, hearing none, the senator from Windham has moved the Senate adjourn until Friday, February 25th at 11:30. Are you ready for the question? All those in favor, please say aye.
Aye.
Those opposed, nay. The ayes have it, and the Senate stands adjourned until Friday, February 25th at 11:30.